Hello, I'm Virginia and I've been a registered pharmacist for 10 years. In this video, I'll go through 15 questions you need to answer before a doctor, pharmacist or nurse will decide if you can get the yellow fever vaccine and the yellow fever vaccine certificate that you need before you travel. How old are you? If you are over 60 years old or younger than 6 months old, you might not be able to get the yellow fever vaccine. Are you feeling well today? If you're not feeling well today for the day of your appointment where you should get your yellow fever vaccine, and you have a high body temperature or fever, you should wait until you feel better to get the yellow fever vaccine. Are you allergic to anything like eggs or chicken protein? The yellow fever vaccine might have traces of egg, chicken protein, or other things people could be allergic to. If you have any allergies to anything in the yellow fever vaccine, you might not be able to get it. Have you ever had the yellow fever vaccine before and had a reaction? If you have had a reaction to the yellow fever vaccine before, you might need to answer some extra questions or see an allergy specialist to check if you can have it. Are you having treatment for cancer, or have you ever had treatment for cancer, even if it was a long time ago? If you are having treatment for cancer right now, or you're recovering from cancer treatment, your immune system might be weak, so you might not be able to recover if you have the yellow fever vaccine. This is because the yellow fever vaccine is a live but weak version of the yellow fever virus, and if you have the vaccine, it is more likely that it could lead to serious side effects. Have you got a health condition or illness that could affect your immune system? This includes leukemia, lymphoma, or a recent stem cell transplant. So if you have anything that could make your immune system weak, you might not be able to have the yellow fever vaccine. Are you living with HIV? If you're living with HIV, then your immune system might be weak and you might not be able to have the yellow fever vaccine. Are you taking any medicines right now, or have you taken any medicines in the past that could affect your immune system in the past year? If you are taking medicines or have recently taken medicines that could affect your immune system, then your immune system might be weak and you might not be able to have the yellow fever vaccine. Are you having chemotherapy or radiotherapy right now, or have you had these treatments in the past year? If you are having chemotherapy or radiotherapy treatment, or you've had these treatments recently, then your immune system might be weak and you might not be able to have the yellow fever vaccine. Have you ever been told that you might have a problem with your thymus gland? The thymus gland sits here in the middle of your chest between your lungs, and it makes white blood cells, which are called T lymphocytes. These are part of your immune system. So if there is a problem with your thymus gland, then your immune system might be weak and you cannot have the yellow fever vaccine. Have you had an operation to remove your thymus gland for any reason, including during heart surgery? If you have had your thymus gland removed, you might not be able to have the yellow fever vaccine. Have you ever had open chest surgery? If you have had open chest surgery, there is a chance your thymus gland may have been removed. So in this case, you might not be able to have the vaccine. Are you pregnant or planning a pregnancy? If you are planning to get pregnant, you can get the yellow fever vaccine and then you should wait 28 days before you try to get pregnant. If you are pregnant right now, you need to speak to your doctor to see if you can have the vaccine. Are you breastfeeding? If you are breastfeeding, you should speak to your doctor before you get the yellow fever vaccine. Is there a blood relative, such as your mum, dad, brother, sister, or a child, that has had a serious reaction to the yellow fever vaccine? If someone in your family has had a serious reaction to the yellow fever vaccine, then you might share some genes with them, which means that you could have that reaction too. So in this case, you might not be able to have the yellow fever vaccine. So if after all of these questions you find out that you cannot get the yellow fever vaccine, what can you do? Watch this next video to find out.